Right now, somewhere in the world, a mother is taking her very first contraction.
A tiny opening called the cervix is slowly preparing for birth. The cervix opens from 8 to 10 centimeters. This process is called cervical dilation. And without it, birth cannot happen.
But what exactly is the cervix?
The cervix is the lower part of the uterus that connects to the vagina.
Think of it like a doorway between the uterus and the outside.
During pregnancy, this doorway stays tightly closed to protect the baby.
But as labor approaches, everything begins to change.
So what actually causes cervical dilation?
The answer begins with contractions.
Each contraction pushes the baby. Pressure builds, and the cervix slowly stretches open.
Hormones also play a major role in softening the cervix.
One of the most important hormones is oxytocin, often called the love hormone.
Without contractions and hormonal changes, dilation may slow down or stop completely.
Cervical dilation happens in stages.
Doctors measure dilation in centimeters.
At 0 centimeters, the cervix is completely closed.
At 10 centimeters, the cervix is fully open for delivery.
The first stage is called early labor.
This usually happens between 0 and 6 centimeters.
Contractions may feel mild at first, almost like menstrual cramps.
Some women may not even realize labor has started.
But then comes active labor.
This usually begins around 6 centimeters.
Contractions become stronger or longer.
Many mothers describe this as the most physically demanding stage.
And finally, concision labor begins.
This is the final stretch of the Borther.
The cervix opens from 8 to 10 centimeters.
At this point, contractions can feel overwhelming.
But this stage also means the baby.
So how do doctors know how dilated the cervix is?
The most common method is a cervical examination.
A healthcare provider gently checks the cervix using gloved fingers.
They measure how open the cervix feels in centimeters.
Doctors may also check how thin the cervix has become.
This thinning process is called effacements.
Dilation and effacement often happen together during labor.
But labor does not always progress smoothly. Sometimes the cervix stops dilating completely.
This condition is called labor arrest.
It can happen for many different reasons.
Weak contractions may fail to push the baby downward effectively.
Sometimes the baby may be positioned in a difficult angle.
Weak contractions may fail to push the baby downward effectively.
Stress and exhaustion can also slow labor significantly.
In these situations, doctors may recommend medical intervention.
This could include medications, assisted delivery, or even a cesarean section.
But beyond the science, the cervical dilation is also deeply emotional.
For many mothers, labor becomes a test of strength, patience, and courage.
Every contraction brings pain, but also progress.
Every centimeter means the baby is getting closer to the world.
And for healthcare workers, each moment matters.
Because behind every birth story, there is a human life waiting to begin.
So, what is cervical dilation? It is the process where the cervix opens to prepare for childbirth.
It is the process that allows new life to enter the world. A slow transformation driven by biology, hormones, pressure, and time.
And although every labor experience is different, the journey always carries one powerful purpose.
The beginning of a new human life.
But what happens if cervical dilation starts too early during pregnancy?